So good afternoon, everyone. I would like to welcome you to the Strong Systems, Stronger Communities, Strengthening Tribal Health Systems Pre-Application webinar for the 2021-2022 grant year. Before we get started, we do have a few meeting reminders just to ensure that our event runs smoothly today. So first, we're going to ask that you please keep your lines muted just to eliminate any background noises that we may experience. We will host a Q&A session at the end of today's session. You'll be able to use the chat box and unmute your lines to share your questions. And last but not least, today's session is being recorded. We'll be able to provide the meeting materials and session information, as well as a short evaluation via the email that you use to register for today's event. I also like to provide a little bit of information about the National Indian Health Board before we get started. So NIHB is a 501c3 charitable organization organized by the tribes over 40 years ago to advocate for improved health. NIHB is the only national organization of its kind. It serves all federally recognized tribes and advocates on all issues related to health and public health in Indian country. Along with many other services, NIHB provides policy analysis as well as real-time communication to tribes throughout Indian country. And it does its work in partnership with its members, the area Indian health boards, and in places where no health boards exist with tribes in the region. Okay, so before we get started, I would like to introduce myself for those who haven't had the chance to meet me yet. My name is Jessica Dean. I'm a public health project coordinator with the National Indian Health Board. I've been here for officially 1 year on the 24th of last month. It's been very rewarding working with the SSSC project as a project coordinator. I also assist with other capacity building efforts as well as public health accreditation and public health capacity scans. I do want to open a line to see if our other teammates can join my phone to introduce themselves as well. We have Nina Martin on the line. Nina, are you able to join us for introduction? I think it's going to ask you for a passcode to connect by phone, and Isaac has provided the passcode, which should be 760768. And you can find that information in the chat as well. So it looks like we may have a bit of connectivity issues for that. So if she's able to get that figured out later on, we can circle back around towards the end, just so you guys are familiar with the staff that assists with SSSC. Sharice Walcott is our public health advisor that provides technical assistance for us as a co-partner for this grant. She wasn't able to join us, but she does have other opportunities that you'll be able to meet her during the grant period, where they provide technical assistance and links our awardees to awesome resources. So I just would like to acknowledge her as one of our wonderful partners who assist with this grant. Ms. Carrie Joseph, I'm not sure if she's on the line either. She may be having technical difficulties as well joining. But I do want to acknowledge our Deputy Director, Carrie, as well as Sarah Price, who assists with this project as well. Okay. So today we will go over our project and application details, including the 10th SSSC, reviewing the RFA, including the various categories under which you can apply. We'll go over the application work plans, as well as the timelines for project activities and application submissions. So after that, we'll wrap up with an opportunity for everyone to ask questions. So the intent of SSSC, or Strong Systems, Stronger Communities, we call it SSSC since it's such a long term, so it's a mouthful of words. So to make it short, SSSC, some folks call it SSSC. But it's centered on providing tribes with the support they need to implement activities that build their performance improvement, systems improvement, as well as quality and practices surrounding activities. So in addition, the SSSC contributes to the ability to progress toward your national public health standards. Support is offered across two funding opportunities, and the first is the Self-Assessment Award, which allows tribes to assess their capacity in areas for improvements. And the second is going to be your Performance Improvements or Systems Improvement Award. And once again, long words just for one award, so we call that one our PISI Award for short. And this is where tribes are able to propose a project that addresses a need through PI or SI activities. And we'll go into both of those in more detail. So before we do that, I do want to share some information that's consistent amongst both awards. And the first is going to be your eligibility. So to be considered for funding, you must meet the listed eligibility criteria, including being an official entity defined as a federal recognized tribal government, tribal organization, or intertribal consortium. And that's going to be as defined in the Indian Self-Determination Education Assistance Act as amended. So you also want to make sure that you possess a strong interest in and/or demonstrate commitment to public health performance, systems improvement, or public health accreditation activities. If you are a previous recipient of either Tribal ASI, which is what this award was called before, or SSSC in a prior year, you can apply for this opportunity. So being an SSSC awardee also does not restrict your eligibility to apply for any other NIHB awards. You are welcome to do so. You can also apply for both awards under SSSC. So the PISI award as well as the self-assessment award. And we also would like to note that any applications related to the pursuit of healthcare accreditation, such as the AAAHC, JCAHO, or CARF, are not appropriate for this particular funding opportunity. So if you're applying in alliance with those types of accreditation, your application will be disqualified. Okay, so once again, this award is centered on public health practice. So within healthcare, the emphasis is on disease diagnosis, treatment, care for individual patients. So when you think about it, you have the clinical care provider or your doctor or nurse or dentist who helps with your own personal healthcare issues. Let's say if you have asthma, it's going to be your clinical care provider who listens to you describe your symptom. He or she does the necessary tests to make diagnosis and prescribe the right medicines, and then you go home feeling better. In public health, in contrast, we're dealing with the health of the perspective of population, so not just individuals. And then public health takes a look at your whole neighborhood, whether it be your city, tribe, county, or state. And in the case of asthma, if we will also like to use that, for example, here, it's going to be how you figure out how many people have asthma, what's putting them at risk. And then your public health professional is going to work figuring out how to reduce those exposures and cut down on the number of new asthma cases. So public health is concerned with whether the people with asthma have access to doctors and are getting quality care. So if the folks on our side do their jobs right, the neighborhood versus the individual can breathe better. And so we're focusing on public health and public health accreditation. And there very well may be cases and circumstances where healthcare and public health accreditation measures may overlap in some areas, but we do want to distinguish the difference between the two, and activities should be set with the intent of public health accreditation related activities. All right, so let's start by looking at the Performance Improvement Systems Improvement Cohort, or PISI Award. This year, we anticipate 5 awards in the amount of $10,000 each. There will also be an additional $2,000 allowance that will support your attendance at our virtual training or meeting. It has previously been held in person, but we anticipate that it'll be virtual this year due to the current pandemic conditions. So the funding period is going to be from October 15th through July 31st, 2022. And we're going to also cover additional timeline information as well. Got a couple questions in the chat. Let me make sure we stop and get those answered. Yes, I will be sharing the slides with attendees afterwards, as well as evaluation and supplemental documents. All right, so moving off of the RFP for the PISR cohort, there are 8 funding categories under which you can apply for this award. And this is going to include 6 categories related to performance improvement, and then you have 2 categories related to systems improvement. So category 1 is going to focus on your tribal health assessments or your tribal health improvement plans. And the purpose of this category is for tribes to work on completing those 2 activities or either one. So a little background on the tribal health assessment, which is also called the community health assessment. They're interchangeable terms, but it's basically a collaborative process resulting in a comprehensive document that describes the health of your population. You're going to be identifying areas for improvement, identifying any contributing factors that impact the health or outcomes of your community health. And then also the tribal health improvement plan is going to be a long-term systematic plan, just addressing issues identified by the tribal health, the THA or child community health assessment. And then this is often the first step is completing the tribal health assessment, and then the tribal health improvement plan follows that. So you can see this is a really great place to start if you're just getting started with your activities and you want a good foundation of evidence-based information to inform your programs. And they're sequential. So if you already have a tribal health assessment, you can pick up with your tribal health improvement plan, or if you have neither, you can start with your tribal health assessment and then move into your improvement plan. Category 2 focus on strategic planning, and the purpose of this category is for tribes to work on completing a tribal or health department strategic plan following guidance under FAB Standard 5.3. So a strategic plan is basically a disciplined process aimed at producing fundamental decisions as well as actions that shape and guide what your organization is, what it does, and also why it does what it does. Category 3 is related to workforce development projects, and workforce development meaning any activities that are essential for ensuring high quality public health services. And this is going to be through strategies that support your health department, your individual staff members, your staff development and training, as well as the overall workplace environment. This is going to relate back to FAB Standard 8.2. Performance management or PM projects are included under category 4. And performance management is basically a process to monitor and improve public health performance, as well as the outcomes in your public health department. So it's going to be the continuous use of the 4 components of performance standards, performance measures, reporting of progress, as well as quality improvement in project under those. And this is going to correlate back to standard 9.1. Category 5 focuses on quality improvement. So we're going to include the processes just to monitor, improve your public health performance and outcomes. And this is within your public health department. So QI is the use of any deliberate or defined improvement process. And you're going to be referring to a continuous or ongoing effort to achieve measurable improvements. That's including your efficiency, effectiveness, performance, any accountability outcomes or measures, as well as any other indicators of quality in your services or processes that help you achieve equity and improve health in your community. So this is also going to go back to standard 9.2 for FAB. Category 6 is going to be the last category under your performance improvement categories. So would be a great category for tries are a little further along in the process. So this projects that you can put on this relate to gathering of your documentation, making sure that your agency is ready for assessment, any staff engagement or orientation, or even if you're ready to submit those initial FAB accreditation fees, you can actually apply under this category and assign up to 50% of your funding for the purposes of your application fees. And then you have to pick up a second category from the other ones listed to complete the other part of your project. Then moving on to our systems improvement categories, which begin at category 7. So category 7 will include projects designed to highlight health equity, which is a major focus in public health nowadays. And you're also going to have the opportunity to highlight social determinants of health-related projects in your community. So projects related to improved housing, education, law, enforcement, etc. fall under here. And then finally, we have category 8, which features systems, interconnection, coordination, and collaboration activities or projects. So this category will include any projects to highlight improving cross-sector collaboration and collaboration improvement in the efficiency of your public health systems or even systems delivery through developing those interconnections. We also want to note that support and documentation for this category is recommended. So if you have a partner that you would like to improve your interconnection collaboration with, it would be beneficial for you to submit a letter just stating that they're willing and they're happy to work with you on this project. We want to know that there's something that's supported, and those applications will be given, will receive priority will be given when assessing the applications or scoring. All right, so here are just a couple of examples of projects that can fall under PI or SI projects. So performance improvement, we stated the tribal health assessments, the improvement plans. We've had workforce development plans, PM systems, quality improvement plans, and even stakeholder and community engagement activities, which is something that's very important, but sometimes often overlooked. Public health, but it's very essential. So for systems improvement examples, we have projects that build partnerships between public health programs or your tribal departments, such as the environmental protection, first responders, healthcare services, and then also projects that work on healthcare transformation and improve access to care. When submitting your application, we just want to make sure that your application is complete. So for Section A, just ensure we have any accurate tribal information, addresses, and contact information, as well as your funding category selected. We want to make sure that we're able to contact you if we need to. And also we want to make sure that if you receive an award, we can get that money to you without any delays. Section B, make sure you include your narrative and scope of work. And then also be sure to include your signed letter of support from your tribal official. And then once again, if you're working on that systems improvement category, if you have any supporting letters from the partners that you'll be working with for those activities, include those as well. And I will review the work plan. So the work plan for PISI Award is generally more detailed because there's a lot more work related to the activities that have to be completed. So under Objective 1, everything's going to be pre-filled for you. These activities are going to relate to the mandatory training with NIHB. So you don't have to fill anything in for this one besides the person's responsible. Everything is paid by NIHB under that $2,000 allowance that occurs with the travel, or if we have to go virtual, you can use those funds to support your virtual attendance. Objective 2 is the same and includes information related to activities that will be conducted during the duration of the grant cycle. So you don't have to change anything here as well. Just assign your personnel that will be responsible for the activities. And speaking of additional activities, Included in the work plan under Objective 2, these are going to include your site visits for first-time awardees. So these are normally hosted by the new awardee in NIHB, as well as a mentor site from another tribal community, travel to you. We will have to determine the feasibility of that happening with regard to the safety and protocols set forth by your tribes regarding the current pandemic environment. So that will be pending, but if we have to conduct that virtually, we have the capacity to do so. This year, we actually did this virtually and it turned out really well. So we're not going to let it stop us. We're going to keep going, and our first time awardees will still gain that experience this year either way. We also have our NIHB training where we cover various public health related topics related to accreditation. And we also have our partners join us to share resources, and our awardees get to share a little bit about their history in their public health department. So I think this is actually one of my favorite activities that we conduct, just being able to get to learn from each other and more about the backgrounds and where everyone is coming from. Another one of my favorites is going to be our talk for our tribal accreditation learning communities. And this is basically our meeting grounds. It's not really formal. It's just our space and opportunity to share resources, success stories, and challenges. So we meet once a month, every third Monday. We're on a break now while we get our new awardees on board. But we just cover any topic, because if there's anything of interest, something that you're going through that's challenging, if you've had a great conference presentation and you just want to share your work, this is where we do that. And you don't have to be an awardee to attend these. These are open to the public. So we'll leave the links at the end. So if you like to join us, by the way, as an awardee or just a public health professional working with tribal communities, you can do that as well. Okay, then not too many conference calls. We usually just kick off with our kickoff call and then talks. And you must attend your check-in calls. It's just a quick 30-minute check-in, maybe an hour if there's anything needed technical assistance with. And it's just to discuss progress, request technical assistance or project evals. And we set those schedules during the kickoff meeting. So it's based on your availability as well. Okay, so start a work plan with Objective 3, and this is going to be where you will begin to highlight the details of your proposed activities based on the categories that you select. So you want to fill in each section of these in good detail. You can add activities if you need to, so add roles. But you really want to just make sure that you're conveying clearly what it is that you're achieving and what steps or activities you're going to complete to get there. So when filling this out, each activity does not have to be assigned funds, but you will need to make sure to include funding where needed and that it adds up to the $10,000 or however much you're requesting for your project. So for deliverables, you also want to make sure that they are clear, something you can produce. So for example, if you hold a meeting, you want to include something such as your agendas or your sign-in sheets, or if you're bringing on a contract, your deliverable could be your MOA. So then I just wanted to pull in an example for you guys. This is just an example from a previous awardee, no names or anything, but you can see the activities that they conducted and how they highlighted it, as well as their funding. Once again, funding was not always tied to each activity, but you can see how they listed out details of what the activity is, how they know that the activity has been completed, their deadlines, as well as their persons responsible. Okay, so RFA submission, which is very important. So we're asking that you submit all sections as a single Microsoft Word document and a letter of support as a PDF. And just want to make sure you submit those by email with Strong Systems, Stronger Communities application, the subject line. They'll come directly to me. My email address is jdeen@nihb.org. We are asking for these by Friday, September 24th at 11:59 p.m. And once again, the project runs from approximately October 15th, when notifications are sent out to awardees will conclude on July 31st. So this is just a little bit high-level overview of the timeline for this project, and it includes things such as your mid-year reports due in April. If you need carryover, that's due by June. Your recommended deadlines for completing your deliverables of June 30th, and your submission of final reports. So this information will also be included in our kickoff calls and our check-in calls, and there'll also be different reminders just to make sure everyone is on track. Okay, so we are right at halftime, so let's move over into the self-assessment cohort. Okay, so the self-assessment cohort is designed to provide assistance related to performance improvement activities or practices, as well as your system integration. And it offers a unique opportunity to get support with public health accreditation efforts through the conduction of a self-assessment. And this self-assessment is really evaluating your performance capacity, and it gives you the opportunity to assess where you are, what areas are performing well, as well as areas that you can use some improvement. And this is going to relate back to the domains of public health accreditation. And we provide guidance and training to help you understand which each of those domains means, and how it ties into the assessment, how you can work with your team to get those conducted. We help you with the background of formulating your teams, who should be included, different considerations, and that's done through the in-person or virtual meeting for this cohort. Here we anticipate funding 3 awards and the amount of $3,000. This award runs from the same schedule as the PISI award, with the exception that we end a little bit early for these activities. So once you've completed that self-assessment activity in May, we'll pretty much be done, but we do ask you to still join our talks, or if there's any technical assistance that you need, you can always continue to reach out about that as well. Okay, so the work plan for this cohort is a lot more concise, and the cohort that develops their project, so the PISI cohort, so this particular cohort is ideal for tribes new to public health accreditation. We've had some tribes who've just heard of it and they like to get more information and training about it, or some tribes who are not sure if this is something that they like to pursue and they just want to get a good grasp of where they are and what the next steps look like for them. So this is a great cohort for tribes who are in those positions and have not actually begun any public health accreditation activities. All right, so this is just a little bit of information about the domains that we discussed before. So to complete the assessment that this cohort does, the awardees receive training related to the 12 domains of public health accreditation, their accreditation team development, and we also walk through the completion of the assessment tool and what that looks like. In addition, our partners join those calls, so FAB, NACHO, ASTO, they'll be able to join and provide resources that can be helpful for the conduction of this, just to make sure that you have everything that you need to be successful and make the most of this opportunity as well. Right, so here is objective 1 of the work plan for this cohort, and it's already predefined for you. The only thing that you have to do is insert your persons responsible. Objective 1 is going to focus on just tailoring that group that will be working with you for that assessment. So creating your team descriptions, obtaining approval from the supervisors to participate, as well as scheduling your regular team meetings. All right, and then objective 2 is really similar to the PISI cohort, where you're planning to get ready for the SSSC training. I do want to note that we conduct our trainings separately. So if you're in the PISI cohort, we'll have a cohort designed for that awardee group, just because they're a little bit more advanced in some of the activities or information that we go over may be something that they already know. So we want to make sure that what we're providing is really beneficial and it's not too repetitive for you. So they'll have one session, and then the self-assessment group will go over more preliminary information that helps you get a good start with pursuing public health accreditation. So it could even be something as simple as Public Health 101. Also, like I was saying, we help you with trainings related to putting your teams together and details behind that as well. And then we also take into consideration if there are any topics that you have an interest in, or if there's a gap in your public health department, and we try to tailor it to meet the needs of your department. Objective 3 is where you're going to be really deep diving into that assessment. So looking at identifying those participants, completing the assessment, all your invitation lists, and then activity 3.5, prioritizing accreditation domains based on the results. So not only are you going to be able to conduct these assessments, but you're really going to be thinking about how do we take this information that we've obtained and use it to move forward or in the future, and what does that look like for our team. We will provide tips for making sure that your teams are diverse, things of that nature. So that's that. And then the last but not least, objective 4, it's just going to be some foundational work with your MOAs, your pre-assessment and post-assessment interviews. And this assessment is actually conducted by both cohorts. And it's really just how we see how much you've gained throughout the process, or throughout the duration of the grant cycle. So once you come in, you'll get a snapshot of where you are in the beginning, and then we'll do one as a post-assessment just to see how much you've gained as an awardee. Additional activities are just alike for the PISI cohort. So the talks, the virtual meetings, your check-in calls. And then for this one, I do want to note that we do not have the site visits for this one. So that's really the only difference for additional activities. As well as the RFA submission dates, everything will be due at the same time. So once again, you're going to be submitting a Microsoft Word document with all of the sections included, making sure that all of your attachments, such as your letters of support, are tied in, and attach those letters of support as a PDF. Submit those directly to me at jdeen@nihb.org by 11:59 p.m. on September 24th. And this is the timeline for the self-assessment cohort. So like I was saying before, it's a little bit shorter with activities ending around May. The official grant period doesn't end until July 31st, 2022. So you'll still be engaged with everyone, have access to the resources and everything. And not that it'll be cut off after July 31st. We're still here to assist you in any way you need, any technical assistance afterwards. So feel free to reach out as well. And right. And then we also have our application overviews, just making sure that you include everything for the sections that have to be submitted. Then last but not least, we have our resources. All of this information will be sent to you via email. So if you have any questions, you can always reach out to me. I'll be sure to include everything that we have today, as well as our links to the announcement, and make sure that you have everything that you need to get those submitted on time. And that is all I have. So I want to close that out for a second, see if we figured out our chat and call in technical issues so we can start getting our questions answered. Let's see. Okay, and I know Nina's on the line. Nina, were you able to figure out the chat issue? Let's see. I may have to, let's see, let's bring everyone in here this way so we can open the chats. I'm not sure what's going on with that side. Everyone should be popping up on the screen. I'm going to get someone to unmute so we can see if it's working. No, we have Lene on the line. Lene, can you unmute your line for me to see if we can get the chat option going?
This is Lindsay. It's working on my end.
Yes, thank you, Lindsay. Awesome.
Hi, this is Martha. Can you hear me?
I can hear you, Martha.
Yay.
Good to see you.
You too.
Okay, there we go.
All
Okay,
right.
so here we go.
I think we've got this working. Sorry about that, everybody. But yeah, thank you so much for attending. And, you know, this is to ask questions. If you have comments, questions about the application for this year, we'd love to hear from you. I think the way this is set up, you can put them as the Q&A on the bottom portion, or you can just throw it in the chat for everyone, and then we can just answer those, or use the little raise your hand button so that Jessica can unmute your line.
Yeah. I think everyone should have the option to unmute your line as well. Yeah. And thank you for dropping the link. So Nina put the link for the travel ASI index page that's listed. That's going to take you directly to our SSSC page where you can find out background information. There are examples of previous projects from previous awardees. So you can go directly there, and you'll also have the funding announcement information there if you need to go back and double check anything, but I'll also be sending it to you directly. Right. So any questions? Did I do that good of a job, you guys?
You did.
Yes.
Thanks, Tim. Thanks, Martha. Okay. Okay. So, Nina, was there anything that you'd like to add?
No, I think you got everything spot on, but as Jessica mentioned, as you go through the application packet, which is on our website, if you have any questions, let us know. We know the turnaround is a little tighter than normal, so please just definitely reach out early if you have any questions about the project. And then if you're having any issues with that, so the application, the way we have it structured on the website is if you go to that link that we put in, scroll down to, I think it's the second section, funding, or third section, funding opportunity. There's a link that has the full RFA, the announcement that we're also going to put out. And then you can download the documents through links within that. But if you have any issues, just reach out to Jessica and we can make sure that you get a hard copy.
Okay, awesome. Thanks, Nina. And then I do see a question from Lene. Can anyone download the application? I get an error message. Okay, Lene, I will need to double check with our website tech to make sure that the links are correct. It should be working, but I will be sending everyone an email with the direct links to everything as well. So until we get that figured out, I'll make sure that everyone has the application materials. Okay, then Holly said she's able to download. Okay, so I'll double check everything and make sure everyone has everything as well.
Just back to Brooklyn. Yes.
Okay, gotcha. All right, thanks, Lene. I'll double check that. All right. So if anyone has anything that you guys want to reach out to us about, please let us know. Always glad to assist and help in any way that we can. If there are other tribes that you know could really benefit from this project, feel free to share the information. We'll also be linking the recording from today on the website as well. There'll be a few correspondences coming out about reminders for submitting applications. But in the meantime, if you have anything that comes up, just let us know. All right, and then also Nina has put her email address in the chat if you would like to reach out to her as well. So anyone on our team. Other than that, thank you guys for joining us, and I hope you have a great day.
Thank you. You too.
You're welcome.
Bye-bye.